And so when I met you and you said to me, actually, we can do something about that, I was in a state of shock. I couldn't believe it, because I came here with the expectation of finding out about stem cell therapy, and perhaps in 2 or 3 years' time we might be able to do something.
Yes.
But I wasn't ready for you to say to me, look, we can do something about this now, because what I had been told by 2 leading experts in the field was something completely different.
I think we're perhaps, to be fair, we're at the cusp of a change. And when the cusp of a change, when the hip arthroscopy, for example, started, or femoroacetabular impingement surgery started, we were seeing the same sort of a change. Some of the people were converted, others were converting. So that is perfectly reasonable. When the new innovations or treatments are coming, we always have that effect, the transition effect, which is quite normal. Around the time of surgery, you were on crutches afterwards?
Yeah, but not for very long.
How long were you on crutches for? A couple of days.
Day or 2 days.
And in 6 weeks or so, how much could you walk? How many minutes could you walk?
A lot, actually. A lot. I mean, I could walk. I needed the crutches for a few days and I was on a walking stick. But because I had pushed the baby in a pram, I could walk quite some way because a lot of the weight was taken on the pram.
Yes. So that's a good tip. Have a baby first.
Get someone pregnant.
We won't offer as part of the package therapy. Right. And tell me, you're in France somewhere, and cycling was one of the main things. Static bike. How soon were you in the static bike?
Within couple of weeks, I think. Pretty quick. Yeah.
Right. In terms of hitting 10 minutes, 15 minutes on the static bike, how soon did you?
I mean, very soon.
Right.
You know.
And outdoor bike, when did you first touch it?
Well, really, when you said to me I really went with your instruction. So when you said you're ready to go on the outdoor bike, I did, but I was doing about half an hour on the static bike first.
Yes.
And that was probably, I would guess, 2 or 3 months in after the operation, I guess. I can't remember exactly.
Got you. Painkillers. What's the status of the painkillers now?
I never took them. I never needed them. I mean, I think after the operation, maybe for the first day, I took 1 or 2, and that was it, really.
Okay. That's not the norm. Sometimes patients do need it more often, but we're seeing that sort of a comment when you're combining cell therapy. The hip feels a bit more smooth, and we're seeing less and less needs for the painkillers, and or less so compared to when we were not combining the cell therapy with the arthroscopy itself, which is something we did not anticipate and we did not tell you because we did not know about it. So it's interesting to have your point of view as to how you felt, which helps us educate the future patients per se.